Hi, I'm Felix. I'm a Paediatric Advanced Clinical Practitioner or Advanced Nurse Practitioner. I'm relatively new, so I've just finished my Masters in Medical Science that allows me to do this role. My background is in paediatric nursing. I qualified in 2005 and I've had a varied experience including burns, plastics and orthopaedics, and also working in children's clinical research for 3 years, and then the rest of my time has been in paediatric emergency nursing, and that's the arena I currently perform advanced practice roles in. In terms of what a typical day for me might be like, I work just sort of 2 shift patterns, so I do either 8 till 8 or midday till midnight, and I work in the University Hospitals of Leicester's Children's Emergency Department, which sees around 66,000 children per year, and then I will see any undifferentiated child between the age of birth to 15 years, because once you turn 16 at our establishment you go over to the adult side. And that could be a range of things, so it could be a jaundiced baby, right down at the birth end of the spectrum, up to sort of a 15-year-old with a perforated appendix or other form of acute surgical abdomen, and anything in between. So I'll go and see what we call red calls that are received into resus, so that might be major trauma or major illness, and I'll work in a similar manner to what's more traditionally associated with medics. So in a more medical manner, I'll do a full assessment, primary and secondary survey, and then cephalocordal exam, including body systems, and come up with a list of differential diagnoses and prescribe any medicines that need prescribing and any other treatments that are required.
What do you enjoy about your job?
I think I really enjoy the challenge that it presents, purely because it makes you have to think about multiple things. So, for example, you've got a set of symptoms being presented to you in a child, and as everybody who's worked in any kind of healthcare setting knows, that there are a lot of mimics. So it could be one thing, it could be another, and the thing that I particularly enjoy is working out which one it is. And I have a real interest in paediatric medical research, so I'm a particular fan of likelihood ratios because they can be applied to symptoms, and I like to utilise that in my clinical practice. So when I find clinical signs or positive clinical signs and symptoms, I then think about what the data is that backs those up, that increases the probability of it being X or Y.